gel on a burn, but this is specifically designed for burns. Minor burns, not major burns, okay? Burns are no longer classified as first degree, second degree, and third degree. I don't know if you guys know this or not. Several years ago, they were redefined as partial thickness, a superficial partial thickness, and full thickness. And it's based on the damage to the tissue and the skin and such. But that works for that. That works for sunburns and minor burns like firecrackers or whatever, you know, that stuff works really good. Beyond that, with burns, the best thing you can do is just run it under water for as long as you can, because the main injury comes from not stopping the burn.
Butter and salve just hold the heat in.
What's that?
Salve?
Salve?
And butter hold the heat in.
Yes, ma'am. Yeah, I wouldn't recommend using them.
Dissipates the heat, the fire heat.
Yeah. Anything that's petroleum based or fatty, that's not going to help. Just keep flushing it with water. Most of the damage that comes from burns is that we think the burning stopped because we're looking at it and it doesn't do anything, but it's actually still burning the tissues. So that's why we always recommend flush it for at least 15 minutes. Just keep flushing it, because so much damage causes after that. So what else do I have? I have some various trauma dressings and gauze pads, just, you know, 4x4s and whatever. Talking about temperature emergencies, I have some cold blankets, you know, for somebody. I have iodine swabs, alcohol pads. This is important for your own self, and it's just Vinex hand cleaner. You would get Purell. You know, this is essentially this, just a little bit different. Here's my Benadryl that I keep. I just keep it with me. I keep Neosporin or triple antibiotic ointment, but which is Neosporin. I keep activated charcoal. Do you guys know what activated charcoal is? Actually, charcoal is an incredible tool. We use it from everything from filtering water to overdoses, treating people with overdoses. The way charcoal works is it's called an adsorbent, A-D-S-O-R-B-E-N-T. So it doesn't absorb like a sponge would. Charcoal adsorbs. And this is why if you're camping or something and you drink bad water, it won't fix the problem, but it'll make your stomach feel a little better if you eat a little bit of the charcoal from your campfire. Because what it does is it takes a lot of toxins. Specifically in my brain, I'm thinking of Tylenol, because kids suck Tylenol down like crazy and Tylenol will kill you. And it, like a magnet, it sucks those particles to the charcoal. And that way it's not absorbed by your GI tract, and then they just pass it normally. Now, if you do get activated charcoal, this is called Actidose. It's cheap, it's like $3, you know, whatever. Primarily, my reason for giving it would be if I was in an emergency situation, is if I was way out in the middle of nowhere and I know this kid overdosed on something like Tylenol, because it works great for Tylenol. The problem is that it's incredibly messy and it tastes exactly like you think charcoal would taste. And it looks like charcoal and water, you know? And it will get, if I open this cap, I kid you not, we would have charcoal on that back wall. We've done it in the hospital 1,000 times, I've done it in my truck 1,000,000 times. And it's always everywhere by the time you're done. It's like red chili. I don't know why. It just gets everywhere. And so, but this is called Actidose, and it's just 25 grams of activated charcoal. Again, this is all over the counter.
Did you say you mix that with water?
This one's already mixed with water. Yes, sir. So, and if you're giving it to a kid or somebody like that, or even yourself, what does help a lot is a cup with a straw, because they can't see it. But don't add anything to it. It's just got a high blood pressure medication. Was the last time I had to give this to a kid, a little 2-year-old. Got into grandma's medication and sucked down her blood pressure pills. But it works like a charm if you can get the person to use it. And that's the hard part with this stuff. But it prevents a ton of liver damage. And
How much?
this is 25 grams. You can't overdose them on that. Yeah, you could give them the whole bottle. Yeah, there should be. Let me see if there's directions on this. For dosage instructions. I mean, this is only 25 grams, so you're not going to cause any problems if you gave them 25 grams. These are just little amps of lidocaine, so they're just for like mosquito bites and things that annoy. I take kids to church camp, and so I also have to carry things like this because they always get mosquito bites or bug bites, and so this kind of numbs the area, and it makes them feel better, but it's by no means a big deal. This is oral glucose. Do you guys know anybody that's diabetic? Yeah? Okay. So there's different forms of diabetes. If you want to pass that on, you can. You can buy that for like $5 at Walgreens. Essentially, and I mean this seriously, that's essentially lemon cake frosting. That's essentially what that is. So if you have a diabetic in your life and they're hypoglycemic, which means their blood sugar gets low, and they often have to take insulin, but they also have to watch what they eat and the whole deal to keep their sugars up. If they have a diabetic emergency and their mental status changes and they start showing signs of shock, they get real sweaty and they're just a different kid, most kids will get really cranky. And a kid that would never cuss a day in his life, a little kid, man, the demon comes out in them when they get low on sugar. They will cuss you up and down. So it's kind of a telltale. But I don't expect you to be able to check their blood sugar level. It's cake frosting. So if you think that you have a diabetic adult or kid with you and they start acting like they're having a diabetic issue, have them suck that down. It takes about 30 minutes for it to fully work. It's only 15 grams of sugar. I mean, it's like half of a Coke. You know what I mean? It's not that much. That one tastes like lemon. You can buy them in, rainbow flavor. I don't know, everything, just cherry, whatever. And they're just a few bucks each. So that's a good thing to have because diabetic emergencies happen a lot, especially, to children, but also adults. But only if you think that you can give that to them and they have control of their airway. They have what's called an intact gag reflex. So if you feel like they're speaking to you in a way that they're not having any problems breathing, they're not flaccid at all, they can swallow and follow commands, then you can give them that. But don't try to just put it in their mouth because they're diabetic and they're unconscious. That'll cause more problems, okay? And unconscious? Well, likely that person has a family member around that's very familiar with their situation, and they'll have most likely a medicine that they'll inject that causes the liver to release. It's a really dirty sugar, but it's enough to kind of wake them up and stimulate them a little bit, and then you can have them drink fluids. If not, call 911 and we'll start an IV and we give them a different medication entirely. So what else do I have? More. You can't have enough Kerlix or gauze. I mean, it's incredible how much you need it. Yeah. Seizure. Okay. Yes is the answer, yeah. Head trauma, bites, stings, everything. A seizure is simply your body resetting itself. Now, not to say that it's not a medical emergency, because it's a true medical emergency, but what's happening is, for whatever reason, your neurological capabilities have become completely overwhelmed, and it's causing the seizure. And so it's kind of like an electrical reset. Now, that being said, seizures can kill you. So don't say, oh, it's going to pass, he's resetting. That's not what I mean. What I mean is a lot of things cause seizures. The best thing you can do for the person is make sure the area around them is clear. Because a lot of times, somebody will wake from the seizure 1 minute or 2 minutes later, but they've received injuries because they were seizing, and so they slammed into the wall or they hit the table. But don't put anything in their mouth. Okay, people try to stick pencils and stuff because they don't want them to bite their tongue. Tongue's a big muscle. It can be stitched back together. It doesn't warrant putting something in their mouth. And then if you have oxygen, like if you have a mother or a grandmother or something that's close by, after the seizure's done, you could give them some. But other than that, just keep the area clear so they don't hurt themselves from the seizure itself, and then guide them through it after they wake up. Because when they wake up, they're called what's called postictal, which means they're incredibly confused. And it's a very confused state because the brain, they haven't been breathing. During seizures, you don't breathe. So the brain has been deprived of oxygen. And so when they wake up, the brain's deprived of oxygen, and it's taking time to come back online. Okay, and then that can take several minutes, that can take 30 minutes, it can take an hour for some people, a long time. And so, but oxygen helps with that a lot. So the best thing you can do is keep the area clear so they can't cause any more injury to themselves from slamming into something. Don't put anything in their mouth. And then when the seizure passes, you can render aid like you see fit. But don't give them anything to drink because they very often don't have a control of their gag reflex or their airway, okay? Give it a few minutes, let them start waking up, okay? There's two things the brain demands having. One is oxygen, two is sugar. It will actually choose sugar over oxygen. The only part of your body that doesn't require insulin to use sugar is your brain. Your brain loves sugar. It will always, always, always take sugar. Sugar goes to the brain, it passes the membrane, and it's right there, and it's used as energy, okay? The rest of the body, every other organ, tissue, and cell has to have insulin. The brain doesn't. The brain will always choose sugar. Number 2 is oxygen, and it has to have it to function properly. During a seizure, it's starving from that oxygen. It doesn't have it, so it's very confused, and it takes several minutes after the person wakes up. But again, it's kind of like the kid with the diabetes or the adult. Somebody around knows this person. Rarely is it a new event unless somebody was like kicked in the head by a horse or something like that. You know what I mean? And for the most part, those last for a couple of minutes, and then the person wakes up, and then we get there and do what we need to do. Rarely do I have to medicate somebody who's from a traumatic injury still seizing once I got there. Does that make sense? Now the kids that have epilepsy or status seizures, they very often require, Versed or Valium or whatever, but not like from a traumatic event. So gloves, did you guys see the gloves? That's important. Latex gloves. You can put if you know how to take a blood pressure, put one in. I keep vet wrap with me because this stuff is gold. Love it, love it, love it. I keep an ace bandage. What else do I keep? Ice packs. That you wouldn't need. And then I keep some stuff for peds, like a blood pressure cuff and a stethoscope for them that fits their size. That's about it. There's not a lot to it. The triangle bandages. I keep eye wash for eye injuries. Eye injuries, real quick, if you guys get something stuck in your eye and you're treating it, say I get a nail in my eye and you're taking care of me, I leave the nail and then I cover both of my eyes. Because I don't know if you know this or not, but whatever your left eye does, your right eye does, and vice versa. So even though this eye is the one that's injured, so you cover this one, if I look right, if I'm looking over here at this gentleman, this injured eye is looking right also, and it's just destroying my sclera and the fluid and everything else, okay? So you cover them both. Now, a lot of times, that causes people to panic when they can't see anymore and they have the eye injury. So talking them through them, verbal skills is a big deal. And talk through them and tell them you're going to cover both their eyes, but you won't leave them, blah, 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 and keep them calm because you don't want either eye looking in any direction. Does that make sense? And then this is eye wash for that. This is just it's essentially a saline, purified water, sterile saline, except without the salt. This is neosynephrine, great for bloody noses and such. This might not be over the counter, actually. So I wouldn't look this one up, sorry. That's I use this if I'm putting a breathing tube in you, but your jaw's locked, and so I have to go through your nose to get down in your trachea. I use this to stop the bleeding or slow it. But it does work great that's not a lie, it works great for bloody noses. And then just tape, okay? And then I keep my flashlight, my little self-generator flashlight, because they're awesome. And you always need them, especially in the field at night or something like that. If you're looking for rattlesnakes, look for rattlesnakes. It's just a horrible inconvenience to get bit by a rattlesnake. And I also have this. You can buy this for a couple $. This is just a one-way mask for CPR. So never, ever, ever do mouth-to-mouth. Kids can have the same disease as adults can. Are we all clear on that? I know we're not doing CPR, but never stick your mouth on somebody else's mouth. It's just gross. So this is just a CPR mask. I'm sure you guys keep them. And this is just a little one-way valve. And so I can blow in, but the saliva and the various particles and stuff does not come back through. Does that make sense? So, and that's I also keep that in there. So it's. And I think, you guys, that's about it. I hope we covered what we were supposed to. Did we cover what we were supposed to? Yeah? Do you feel like you have any questions, or is there anything we didn't cover? Are you still awake? A little bit? All right, then I guess I'm done. Yes, ma'am. All right.